Hello, how are you all? Hope you are fine and preparing well for AMC Part 1 examination. This is Dr. Zahra and we are solving some Gynae questions to clear the concepts in the exam, and this question has taken from the AMC Part 1 Handbook Blue Book question, and this is question number 3.300 from the handbook question has taken. So let's start discussion. A patient who had 3 successive spontaneous abortions attends at 12 weeks of gestation in her 4th pregnancy. Her menstrual cycle has been regular of 28 days duration. Just prior to presenting for the assessment, she passed a moderate amount of blood with clots per vaginum and had some intermittent lower abdominal pain. On vaginal examination, the cervical canal admitted one finger readily, and bimanual palpation showed a uterus compatible in size with a pregnancy of only 8 weeks duration. Which one of the following is the most appropriate next step in the management? A. Pregnancy test. B. Serum beta HCG. C. Curettage. D. Vaginal ultrasound. E. Cervical ligation. So, serum beta HCG as well as pregnancy test we will not do because we already know that patient is pregnant, so there is no use to perform pregnancy test as well as serum beta HCG level, because the question clearly mentioned here that patient is 12 weeks of in her gestation in her 4th pregnancy, and this is also showing here on clinical examination uterus is 8 weeks duration. This clearly mentioned that patient is pregnant, so there is no use to go for the pregnancy test and serum beta HCG level again. The next option is curettage, which is also the wrong option. We cannot go for the curettage directly. We don't know exactly the situation inside. Might be this is the viable pregnancy. We don't know. Might be this is miscarriage. Might be this is incomplete miscarriage. So, but there are the findings which is more going toward the incomplete miscarriage. What are the findings? First of all, the according to the LNP, the patient is at 12 weeks of gestation, but according to the clinical examination, patient is at 8 weeks duration. So there are some discrepancy. Might be the patient passed some tissues per vaginum, as well as patient is having a complaint of also passing a moderate amount of blood with clots per vaginum. And it's also showing the cervical canal is one finger readily, it's admitting one finger readily. This means the cervical canal is dilated. Ideally, the cervical canal, the cervix should be closed, the os should be closed. In the normal pregnancy, it should be closed, but it is, if it is admitting one finger, that means it is dilated and some tissues are passing through the vagina, as well as there are the discrepancy according to her LMP it's 12 weeks, according to the clinical examination at 8 weeks. This is more going toward the incomplete miscarriage. Okay, that means she passed some tissue, but we cannot do the diagnosis. We cannot go for directly for the curettage until and unless we should confirm the diagnosis by ultrasound. So here option D, vaginal ultrasound, is the correct option. E, cervical ligation, it also wrong option here. Where we are using the cervical ligation? Yes, patient is having a 3 successive spontaneous abortion. Okay, so this is the clear-cut indication to go for a cervical ligation, but at 12 weeks, and there are some criteria to go for the cervical ligation. What are the criteria? It should be done under early pregnancy assessment unit, as well as there are some contraindication is that the patient should not pass any bleeding. There should be no any vaginal bleeding, and there should be a clear cut evidence that the baby is all okay. There is no chromosomal abnormalities in the baby identified, and There are the criterias. First of all, the first criteria, the patient should have a history of 3 successive spontaneous abortion. That's mean we can apply a history indicated cerclage here, but contraindications are there. And contraindication is that patient is bleeding currently. We cannot apply when the patient is currently bleeding, and it should be applied at 12 to 14 weeks. So here the contraindications are there, and also a discrepancy is there, so it's more going toward the incomplete miscarriage, and we have to confirm it through the vaginal ultrasound. This is the first next step in the management, and then we have to go accordingly, suction and evacuation and curettage. So this is the correct answer. Vaginal ultrasound is the correct answer here. And cervical ligation is not the correct option. I already mentioned it should not be applied when the patient is bleeding. Yes, this statement that history indicated cerclage we can go for because he has a history of 3 successive spontaneous abortion, but due to bleeding, this is not the correct option. It is contraindicated to perform cervical ligation, cervical cerclage with a patient who is having a vaginal bleeding. I hope this question is clear to you now, and thank you very much. Bye bye.